My name is Derrick Reyes, and I'm the CEO and co-founder of Queerly Health. Sure. Like many Americans, cost is a big barrier to access. Location. So in a lot of metropolitan areas, you can find pretty easily LGBTQ health clinics. But what happens if you're like a trans woman who lives in Kansas? Another barrier to access is discrimination. Over 50% of LGBTQ people experience discrimination in healthcare settings. Lack of provider knowledge is a huge one. It's not really taught a whole lot, LGBTQ health in healthcare institutions. Anti-LGBTQ health laws are another one across states and at the federal level. We have to call things by their names. So addressing stigma, whether it's within the healthcare industry or any industry at all, we see a near future where all healthcare settings are going to be LGBTQ inclusive. We can't speak like that. We can't see that future unless we know that right now there's a stigma that needs addressing. So it's really important to address the injustices and the prejudices that people have to face, and that eventually lead to the inadequacies in industries like the healthcare industry when it comes to LGBTQ people, so that we know where to start so we can start fixing it. I think a great way for providers to start is with themselves and trying to gauge like what level of explicit or implicit bias they might have towards LGBTQ people. What do you know about LGBTQ people? Do you know how to treat LGBTQ people? Do you know any LGBTQ people? If you don't, now you do. So it's really important that people start to ask themselves, how can I create space for people who don't have identities like me, or maybe have marginalized identities other than my own? So yeah, start with having those conversations with yourself first, and then ask other people, other LGBTQ people, ask the internet, how do I make myself, my practice more LGBTQ inclusive?